Good morning, everyone, and thank you for tuning in to our live virtual town hall. Today is October 14th. I'm Staff Sergeant Sean Martin from the Eielson Public Affairs Office, and I'm here with Colonel David Berkland, the 354th Fighter Wing Commander, Captain Alysha from our 354th Medical Group, and our Command Chief, Chief Master Sergeant John Lokken, and they're all here to share the latest info regarding base happenings and COVID-19. Just a reminder, we'll be taking questions in the comments section throughout the show, so please keep them coming. Let's start with updates for the wing. Colonel Berkland?
Yeah, thanks, Sergeant Martin, and thanks for everyone tuning in. This is Dave Berkland, the Fighter Wing Commander. I appreciate everyone taking the time to listen in, and we're looking forward to answering your questions as we go through this. So as far as what's going on the base, if you haven't noticed the sound of air power out there, I think I can hear it right now. We have red flag going on, red flag Alaska 21-1. So it's our first exercise of fiscal year 21. We've got a great assortment of joint teammates that are here in town. So it's the first, since COVID popped up back in March, it's the first red flag Alaska we've done that has joint air partners involved. So we've got the Marine Corps and our Navy brothers and sisters here executing the missions with us. So specifically, we have the 14th Fighter Squadron from Misawa with their F-16s. We have our own 18th Aggressor Squadron flying our F-16s. We have the 168th Air Refueling Squadron with the KC-135 tankers. We have multiple different air control squadrons controlling the fight that's going on in the air. The 610th Air Control Squadron, as well as the Marine Corps Air Control Squadron number 4, the 117th Air Control Squadron, as well. We've got our own 356 Fighter Squadron flying our F-35s as part of the fight. We have VAQ-132, which is a Navy electronic warfare squadron flying the EA-18G Growler. See those out on the ramp. We have VMFA-232, which it's an F-18 Marine Corps squadron from Miramar in California. We have the 2nd Recon Anglico guys. Those are also JTACs from the Marine Corps. We have the 3rd Special Forces Group, Special Operators. And then we have the 18th Field Artillery Brigade executing the HIMARS, which is a precision artillery system. Down at J-Bear, we have some participants as well. We have the 517th Airlift Squadron flying C-17s. We have the 909th Air Refueling Squadron, which is also a KC-135 air refueling unit. And then we have the 18th FAB down there as well, doing the HIMARS artillery, as we discussed. So that is going on. You'll hear the sound of air power out on the ramp, and a little more than normal because of all those players going out and fighting out in our awesome airspace. So that's the big thing going on right now. As far as the COVID situation, we are still in HPCon Charlie. So I kind of wanted to throw down with a little bit of a definition as to why we're in health protection condition Charlie. So we went into Charlie a little over a month ago now, back in September, when we started to see a pretty significant uptick in the cases of COVID here at Eielson. We remain in Charlie because since then, while we have done an outstanding job on base of keeping it under control, the local community has seen a significant rise in the cases of COVID. And you can just type this into your Google search if you want. If you look at Fairbanks COVID numbers, again, the numbers are significantly going up. So that's what we use to determine the HPCon is really what's going on in the community. So from the actual Air Force instruction that defines the HPCons, Charlie is for a substantial disease threat, so high morbidity, epidemic, or contamination. So morbidity being just sickness occurring in the community. So the definition is that there is a substantial threat of disease for personnel due to a local epidemic, outbreak of a disease with a high morbidity rate, imminent spread of such a disease to the local area, and or a wide area of contamination that requires special or costly avoidance procedures. So based on that and what's going on in the communities, just based on the numbers, we remain in HPCon Charlie. I know it's painful, I really do, but it's the best thing we can do right now to maintain a balance to ensure that we're keeping our people and the mission safe and they're able to thrive, both of those things at the same time. And that's the challenge for all of us, is to strike the balance between those two things. But I'm going to hand it over to Captain Doe to kind of talk through some more specifics about COVID in the local community.
Good morning. Thank you for having me. Sir, as you said, when we went into Charlie in September, since then we have seen a steady increase in the number of positive COVID cases in the Fairbanks North Star Borough. And just in the last 14 days, the minimum number of positive cases have been 21 with a maximum of 75. So there's a wide range in there, but the steady increase is there. The good news on Eielson is that those numbers have been much lower. We've done an excellent job of doing contact tracing. Our technicians have really been on it and identifying those individuals who may have been exposed to COVID. And we've done so well to this point that the majority of positive cases we have seen have already been identified and were in quarantine when they became positive. So kudos to that team especially, and kudos to all of those out there who are doing the right mitigations, wearing their masks, staying 6 feet apart. It's been outstandingly helpful.
Yeah, that's a great point. And that has been one of my observations as the commander, is how, because I get the daily reports on our positive test cases, and the vast majority of them, since we went to Charlie, due to the aggressive contact tracing efforts, the vast majority of those positive tests have come from individuals who are already in quarantine. So I think it's important to talk about some definitions right up front. So we have ROM, we have quarantine, and we have isolation. Do you want to talk through those real quick, or do you want me to
Absolutely.
hit those? Okay.
All right, so isolation is when you have tested positive for COVID-19. You have a positive lab in your hand. You know that you're positive. The CDC guidelines for individuals going into isolation is 10 days of isolation from the date of onset of symptoms, or the start of your symptoms. So I know there's been a lot of confusion regarding that, because some people have symptoms before they get a test. So then we have to backtrack, do some math. You may only have 7 days of isolation left by the time we know you're positive. For quarantine, you have had a known exposure to COVID-19, so someone who tested positive. So those individuals will remain at home, separated from their family members. The more separation you can get, the better, because if they turn positive, as many of ours on Eielson have, anybody they've been in contact with will also go into 14-day quarantine.
Can you talk about contact specifically? How do we define a close contact?
Yes, sir. So the CDC defines a close contact as within 6 feet for 15 minutes or more. The DOD is even more conservative, and so we base our contact tracing on 10 minutes.
Okay. So when at all possible, what our people are doing is they're staying outside of that 6-foot bubble for 10 minutes. So workplaces are socially distanced. All of our public spaces are socially distanced. There are some places on base where you just can't do that. There are some duties that some of our airmen have where they just cannot do that, and that's where we've seen some of these flare-ups, if you will, occur, where you have one individual test positive. They do have multiple close contacts that were inside of 6 feet for greater than 10 minutes. Those individuals that were close contacts go into quarantine, and then let's talk about testing. So we've been testing those individuals even though they're not symptomatic, right?
Correct. Yes. So once you're identified as a contact trace of a positive individual, we'll ask you to come into the med group to our COVID clinic, and you'll be tested as well, because we want to make sure that you potentially aren't asymptomatically spreading that virus already. So we have had some cases where people come in, they're asymptomatic, but they were a contact trace, and they were positive, and then we have to do follow-up contact tracing on them. And so the biggest goal is to stop the chain of infection of this virus, and that's how we do that.
Exactly. Okay, great. Thanks for those details. I think it's important for everyone to understand. Okay, I think that wraps up the current happenings. Oh, ROM. You want to talk about ROM?
Yeah, we'll talk about
Let's
ROM.
talk about ROM. What does ROM stand for?
Yeah, so ROM is restriction of movement, and it's sort of a third category outside of isolation and quarantine. And it applies to individuals who travel outside the state of Alaska. The state of Alaska health mandates kind of help us determine who those people are for the most part. Basically, if you've traveled outside the state of Alaska, you are required to be on a 14-day restricted movement on base. So basically, you're not in prison in your house necessarily, but you can't go to public places. You can't be in groups. You can't socialize with people outside of your family. But you can go through a drive-through on base, pick up, sunrise or something like that. Curbside groceries.
Can we talk about why we do that? Why do we do a 14-day restriction of movement for people who come into the base or come back to the base from a TDY?
Right. So because we're in a pandemic, anytime you leave the state, you travel through airports, you put yourself at risk of being exposed to COVID-19. The incubation period of this virus is 2 to 14 days, so that's where the 14 days comes from. And then it's just that risk mitigation. So that's what we're trying to do.
Yep, absolutely. Okay, that's great. Do you happen to have the numbers for the local area that we could talk through?
Sure. So for the most part, the state of Alaska is averaging over 100 cases per day. Just yesterday, 157 cases were reported in the state.
So those are new cases yesterday
New
in the
cases.
state. Yep.
Yep.
Okay.
And just to give you an idea, the state publishes alert levels, and they're based on the daily average positive case rate over 14 days for a population of 100,000.
Okay. Can you actually tell me where you found this information, and we can tell everybody where they can find this information?
Absolutely. This is from the Alaska Department of Health and Social Services website. If you Google COVID-19 Alaska, it's one of the first websites that will pop up for you.
Okay.
But in terms of risk level, Alaska has been rated high, which is 10 cases, over 10 cases out of 100,000 population. Fairbanks North Shore Borough is ranked second highest in the state over Anchorage Municipality.
Okay. And who is the one place that's higher than us here?
The Northwest region.
Okay. And that's driven by their low population
Yes,
count,
sir.
right? So it's not really statistically significant, kind of an outlier. So we're driving the state numbers right now, the Fairbanks, North Star Borough,
We're
Sounds
driving the incident rate.
the incident rate.
So
Okay.
based on our population size, we have more on average over the last 14 days than anywhere else in the state.
Okay.
Thank you for that awesome information, Colonel Berkland and Captain Doe. With that, we're going to take a short break. Again, you're listening to the 354th Fighter Wing live virtual town hall. When we come back, we have more with our leadership team, and they'll be answering some of your questions. And we're back. If you're just joining us, this is our live virtual town hall. I'm Staff Sergeant Sean Martin from the Eielson Public Affairs team, and I'm here with our commander, Colonel Berkland, and Chief Lokken, our command chief. Sir, just a few questions we have here for you. Why did we stop town halls?
Yeah, that's a great question, and I understand that people had kind of gotten used to having the town halls. So originally the town halls were started, and this was before I was here, but the town halls were started as a way to communicate a rapidly changing and somewhat chaotic environment when the pandemic broke out back in March. So that situation had changed and somewhat stabilized through the summer. So I think that was when the original decision was made to stop doing the regular town halls, because again they were only designed to address the COVID situation, which was largely under control at that time. More recently, we've noticed that there obviously is a uptick in the COVID situation here locally, and there's questions and a little bit of confusion about what we're doing and what's next regarding COVID. So it seemed like a good time to readdress some of those questions, kind of readdress the topic overall, and make sure we're communicating with the whole family here at Eielson.
Awesome. Thank you, sir. We talked a little about it in the first segment, but regarding the Red Flag Alaska personnel who are here on base, what are some precautions that were taken to them prior to arrival and also while they're on base?
Yeah, that's another great question, and probably something that a lot of people aren't aware of is that every unit that's here supporting Red Flag Alaska and participating in Red Flag Alaska went through various forms of risk mitigation for COVID. For example, the team from Misawa in Japan, which, by the way, Misawa Air Base at the time when they deployed had 0 cases of COVID. That team, nonetheless, went through a 14-day restriction of movement prior to departure. They were required to take a COVID test prior to boarding the aircraft, and the aircraft they boarded was a military flight. So they went point to point on a military flight. In other words, they didn't transit any airports. They didn't get on an airplane with other people who hadn't gone through those protocols. So they arrived here at Eielson. They got off the aircraft, and we immediately put them into a cohort-separated living and working arrangement. So if you go over to our combat training squadron and you look at the way that the ops are being executed and the mission planning is occurring and the briefings are taking place, you'll see that there are separate areas for the visiting units as opposed to our home station people that work there normally, and they're working there now to support the Red Flag that's in town. So we're doing an aggressive cohort management, and that applies across the base. So there's certain hours where the Red Flag participants can go to the shopette, certain hours when they can go to the BX and the commissary. So that's just another way that we're cohort separating them. They need access to some basic facilities while they're here on the TDY, but we make sure that they're accessing those at a time when our people are not there, just to drive the risk down even further.
Awesome. Thank you for that, sir. This is in regards to the HPCon changes and restrictions for military members. How are those restrictions determined, and what prompts a change in the HPCon level?
Yeah, another great question. I think we addressed, the definition of the HPCon and kind of what drives our decision making on that. But overall, I mean, it's really a combination of different variables. The local community spread kind of is the one variable we keep our eye on, and again, that's the number that keeps going up that leaves us in Charlie at this point. But besides that, we're constantly monitoring guidance and updated understanding of the disease from the CDC, from the DoD, from our professionals in public health, as well as people in the local community. We're in touch with the local leadership. I communicate regularly with the mayors from Fairbanks, North Pole, as well as the Fairbanks North Star Borough. So it's a combination of all that. Again, trying to maintain that balance between making sure that our people and our mission are thriving and they continue to be safe.
Awesome. Thanks again, sir. We have a question here for Chief Lokken. Sir, with the upcoming holiday season right around the corner, can you talk a little about the visitor base access policy?
Sure. The visitors on base. So in the overarching theme of all this is trying to keep the mission safe and the people safe as we're walking through this COVID stuff, because it's spiking back up again and we got to walk through it, and we're willing to take risk on some things in order to make the people thrive in what we're about to walk through. So I just need everybody to understand that each case is different, and coming up with a blanket policy that's either too restrictive or too liberal can put both people and the mission at risk. So we got to find a way to do that, and what we've done is push that kind of stuff down to the squadron level. So each squadron, people can come visit. We're not saying that they can't, but we have to take precautions and do things smartly and in the right way. And we're trusting the squadron commanders and the chain of commands for everybody to do that and ensure that people that come through here, first of all, they're going to have to comply with the Alaska guidelines first and foremost. That's probably the biggest piece of it. And you can find that on Google, on the internet somewhere, the Government of Alaska's guidelines.
That website, sorry, I didn't mean to cut you off, Chief, but that website's actually dhs.alaska.gov.
Great. So yeah, if you could go out there and find those for anybody that wants to come up to and visit the great state of Alaska and see what we do up here, especially during the winter, because it's going to be fun this winter. But yes, please do that, and then work with your chain of command to get any sort of ROMing or whatever safety policies that they want to put in place for your specific scenario is the way they need to go.
Awesome. Thank you both to Colonel Berkland and Chief Lokken. With that being said, it's time for another short break. You're listening to the 354th Fighter Wing live virtual town hall. When we come back, we'll be answering more of your questions, so if you have any, drop them in the comments section now if you haven't already. Welcome back. You're listening to the 354th Fighter Wing live virtual town hall. Before the break, we talked about our way forward with the town hall, addressed some questions about the exercise, and HPCon changes. And with that, I'll turn it over to Colonel Berkland for some further words.
Okay, thanks, Sergeant Martin. So we're getting some comments about red flag participants who may not be following the procedures that we've outlined for them. And I'll be honest, I haven't seen it, and I don't know of that happening. The first thing I would say is that if you see someone doing that and you know that they're here for red flag and they're not following the rules, I would ask you to approach them and tell them that they need to follow the rules, and the rules are A, B, and C. Obviously, keep your mask on and keep 6-foot distance while you're discussing this matter. If you're not comfortable doing that, or you don't have the chance to do that, then I would engage with the chain of command. So with the key spouse, with the first sergeant of your organization, or with the chain of command otherwise, please highlight this because if we find out about it, I mean, I am in daily contact with the deployed force commander who's in charge of all the red flag participants, and I guarantee he will make sure that that's fixed. Chief Lokken's in daily contact with the senior listed leadership of the red flag personnel, and that will be fixed, but we have to know about it. So I appreciate you guys bringing that up to us, because I was not aware of that. Next, let's hit on the visitors. So Chief Lokken talked about visitors coming over the winter months, and we can see now it's starting to get colder. The days are getting darker and shorter, and we're getting into that winter season. I think it's really important that everybody knows that visitors are not only allowed on base, but they're encouraged. And I can tell you from my personal situation, so prior to taking command here at Eielson, I was in Afghanistan for the year, and came back, quickly got checked out in the F-35, and then brought the family up here in August. And I haven't seen my mom and dad in coming up on 2 years now, and they can't wait to get up here. So we are going to figure out a way to do that, and we're going to figure out a way to do that again keeps everybody safe, including my mom and dad, because they're not as young as even I am, and obviously doesn't risk our mission and risk the people on the space. So we will make sure they comply with the Alaska state guidelines, as Chief Lokken indicated. We'll make sure that we're following the rules on base as well as off base to keep everybody safe. But work with your chain of command. Because again, as Chief said, no one understands the particular situation that you may have regarding your work schedule, regarding your living arrangements, and regarding the people you want to have come visit. No one knows that better than you and your specific chain of command. So work with them to come up with a solution. But again, visitors are not just allowed on base and not just allowed to our airmen and families who live off base, but they're encouraged. We've got to have friends and family come visit. We encourage you to go visit them as well. Take leave, go down to the lower 48, follow the COVID procedures. COVID is something that we shouldn't fear, right? We respect it. We constantly seek to understand it better, but we're not afraid of it, right? We do the right things, and as we've seen, as Captain Doe outlined, when we follow the rules and we follow our protocols, it works. It really does work. And the infections that we see happen, we were able to trace them and it actually the science bears true that when you're in close contact with someone who's got a significant viral load, that's where you get the disease. So anyway, just the point is that visitors are encouraged. Please work with your chain of command to make that happen as we get into the winter.
Awesome. Thanks, sir, for that. We have a question here for Chief. How will the base support mental health during the winter months?
So when you say mental health, I take that as a concept, not necessarily specifically mental health like at the med group. So what that does, or what that means to me, is the fact that chain of commands and families and all that, because we're one big family on this installation is the way I see it, and we need to watch each other's back and brace arms. And like the Colonel just said, if we can just be brilliant at the basics with that kind of stuff, then we can get through this kind of thing. But the watching out for each other coming into the cold winter months, which is that's been going on for hundreds of thousands of years, but this time it's going to be different, right? We got COVID that we got to battle with as well, so that's just another layer on top of what it takes to get through here. But it's going to be, so like I said, it's going to be different. I ask that people stay imaginative. I've had plenty of Zoom meetings with friends and just had a beer or cold drink and BS with them over the internet. You use those kind of platforms to do that. I ask that people stay engaged with each other and try and stay connected with each other in any way possible. Maintaining those rules to keep everybody safe. Again, balancing the mission and the people. There's plenty of other things out there that you can use. FSS is working on getting some of the things back open. I think they're meeting with the Colonel this week sometime to discuss that and getting some options back on base so that we have some outlets, because I know people need outlets. They need socialization. We need it to get through this winter. We need it. I know the first sergeants are working through some things in the dormitories for the unaccompanied airmen or the single airmen. So again, I just ask that you be imaginative, work to stay engaged, work to stay connected with people. There's also the USO that's over in the dormitory area for people, so that's another outlet that we can use. They're pretty active or becoming active over there. So again, just be imaginative. That's what it comes down to. It's a tough fight. Not everybody knows what we're doing with the COVID stuff and how to get around it, but there are things that we can do in each little scenario, and each little pod of people can come up with ways to stay connected. It's going to be a fight.
Yeah, Chief, and I'll just pile on with, you mentioned the FSS, and I'll throw a shout out to our FSS and all our airmen and the whole team there in the FSS, just really being creative to come up with ways to take care of our people. So specifically things that the FSS is working on and that you can anticipate in the near future is, first of all, you can find the FSS on the FSS website as well as the FSS Facebook page. So go ahead and look that up to get kind of a rundown of what they're working on. But looking at opening up the movie theater, looking at opening up the bowling alley, looking at opening up the community center, obviously with some COVID mitigation procedures in place, limiting the number of people inside at any given time, as well as just to ensure that the social distancing, mask wear, hygiene protocols are taking place inside those facilities. Looking at opening up sit-down dining options on base, because again, our people have been doing the little stuff right, and that bears out in the numbers. So because of that, because everyone's been disciplined and really trying to protect each other, I'm really interested in what the FSS is working on for opening some stuff back up on base. And the gym, we get a lot of questions about the gym. I mean, you and I are gym rats. I know it's really important to not just our military members, but our civilians and our dependents. I know my wife can't wait to get back in the gym. So we're looking at opening up the gym back up to dependents and civilians, and that's going to be happening shortly. So again, look up the FSS website, look them up on Facebook, and you'll get all those details. But expect announcements in the near future. I'm talking next week or two, first week in November, no later than, we're going to be opening some stuff back up, assuming the situation on base remains stable.
I'd like to just say thanks for everybody in the gym. Yeah, the gym's a big part of our morale across this installation, everybody's, I think, and getting the dependents back in there is a priority for sure. And I just want to say thanks to everybody, the active duty guard members that are in there. The mask use and wiping down equipment use has really on the uptick. So I appreciate everybody's efforts in the gym.
Yep, and again, as we open it back up, it's important for everybody to continue doing that little stuff right, because the gym is considered to be a higher risk kind of place. But because everyone's doing the little stuff right in the gym, I think we're able to start to look at opening back up to more people in there.
Right, brilliant at the basics, like you say.
Yep.
Awesome. Thanks, sir, and thanks, Chief. I know my family and I will be pretty excited for those upcoming openings. We talked about mental health here a little bit, and right now we're going to speak with Major Trevor Peterson, who's going to talk more about the mental health aspect from the medical side.
Thanks so much. Yeah, so we're seeing a lot of questions come across Facebook regarding mental health access, specifically at the med group and for dependents. And unfortunately, our clinic isn't staffed to take care of the mental health specific psychiatry needs of dependents here at the base. But that's a far cry for not being able to support the mental health of the base. So if you have mental health concerns, please come see your PCM. We can do a lot of mental health and primary care. The second thing I would tell you is that reach out to the TRICARE website. You can access a lot of mental health resources in the community with TRICARE without a referral. If you're having any difficulty with that, come in and see us at the med group. We're happy to help you facilitate those appointments and that care. Our intention is not to leave anybody out. Regardless of what the mental health clinic has the capability to care for or not, your primary care manager and your primary care team are here to take care of you. So if you have questions, please bring them to us. We're happily able to take care of your needs.
Awesome. Thank you, sir. And we have a question here that I know has been on everybody's minds, and with the upcoming holiday season. Sir, can you talk a little about Halloween this year and what the base is doing?
I can talk about Halloween, absolutely, and that is a great question. I know everybody's wondering what we're doing. So what we're going to do for Halloween, FSS is putting on a trunk or treat. It is going to be on the 31st of October, contrary to the previous plan to be on the 30th of October, because right now I don't see a way for us to trick-or-treat safely. The CDC has outlined that trick-or-treating is a high-risk activity. They're not allowing it at Wainwright. I don't see us trick-or-treating this year. Therefore, I think it's going to be incumbent on us to be creative, be flexible this year, and everybody come out for trunk-or-treating.
Awesome. Thank you, sir. And on that note, we're going to be taking our last break. Again, you're listening to the live virtual town hall. And we're back. You were listening to our live virtual town hall. With that, I'm going to turn it back over to Colonel Berkland.
Thanks, Sergeant Martin. So we're getting some comments about the Halloween situation. And first of all, I want to just say thank you to everyone who is commenting and participating in this, because it's a great source of information for us. We look at all kinds of different sources of information, and this is certainly one of them we use to get a feel for what's going on. So regarding Halloween, I get it. Everybody, I loved Halloween as a kid. I have some amazing memories from those nights trick-or-treating, and I've got two kids myself that really, they love Halloween as well. They can't wait to get dressed up and go running around and get scared and scare people and just have those memories themselves. So I get it. Again, our challenge is to strike a balance between ensuring that our people and the mission thrive and remain safe. So this year, because of the high-risk nature of trick-or-treating, and I'll hand it over to Major Peterson here in a minute to talk about the details of why trick-or-treating is not a good idea this year, and kind of put it in context. But I get it, and this is the best way we have found to balance both of those things and ensure that those memories are occurring for our young ones and for our families as well. We can get out and have some fun as a community, as a family here on base, but we can remain safe in doing so. So with that, I will hand it over to Major Peterson to talk about that from his perspective in public health.
Thank you, sir. Yeah. So the truth is these are tough times. We're in the midst of the worst pandemic this world has seen in the last 100 years, and we know that this pandemic has spread human to human. And so we all have an individual responsibility to each other to try to minimize those human-to-human, direct face-to-face interactions as much as possible and as much as practical in the weeks and months to come. Halloween is an event where children would have face-to-face interactions with every single house they go to, and the raw number of human-to-human face-to-face interactions inherently increases our risk of transmitting this virus around the base. This is recognized by the CDC, and that's why they've called it a high-risk activity. So what we've tried to do is set up a system where we can decrease the number of face-to-face interactions, decrease the opportunities this virus has to transmit amongst our base population. If nothing else, we're doing all of this to try to protect the population. And from a personal plea from the guy who's been running the COVID clinic for the last 6 months here at Eielson, the more human-to-human interactions we have, the more people I'm going to see behind a face mask on Monday morning. And so the more this base can do to help us out, to help the base out by minimizing those face-to-face human interactions, the better. We know it's a tough stretch, and we know it's a lot to ask, but these are unprecedented times.
Awesome. Thank you, sir, and also Major Peterson for that information. We're nearing the end of our show, but before we go, I'd like to turn it over to Colonel Berkland one last time for anything else you'd like to share with Team Eielson, sir.
Again, I'll just say thank you for everyone tuning in, providing your comments, and participating in today's discussion. Hopefully it's been valuable use of your time. In the meantime, continue to up-channel concerns, questions to your chain of command, your key spouse. Put it in the PA comments on their various social media platforms. Whatever way you can, give us the information, give us your comments. Because again, we do listen to those. I would just want to say thank you to the whole team as well, because we talked a lot about COVID today, but in the meantime, in the midst of COVID and through the fight we have with COVID ongoing, this wing is being transformed, and it's being transformed from a training wing to a combat wing, and that is no small feat. It's not easy, and there are airmen and civilians and contractors, and I know all the dependents are chipping in their own way to make that happen. It's a lot of hard work. It takes a whole team. It takes this whole base and the community that's backing us up to make that happen. But it is happening right now, and it's happening in the midst of COVID. So that is happening behind the scenes in a sense, and I don't know if everybody's aware of that, but it's happening, and I'm really proud of that. And it's not just a combat wing. It's going to be a 5th generation air power combat wing, which is also noteworthy. We're really taking the wing into the next generation of air power, which is impressive. Again, continue to up-channel concerns through your chain of command. I think you guys have access to all the websites, but please, if not, we'll make sure we post all those in the comments. And then the last thing I'll say is that it is getting colder. It's getting darker. We had slick roads yesterday morning. So please, everybody, slow down as applicable. Take your time. Let's stay safe. Let's stay healthy and back each other up. You may not think that you're at risk with COVID, and you may not be, but there are people on this base, whether they're our military members or their dependents who are living with us, who are at risk of not just getting sick, but of dying from this disease. So please keep the entire team and the Eielson family in mind, and keep each other safe and healthy as we go into the winter.
Awesome. Thank you, sir, for those great closing remarks. Well, folks, that's all the time we have today. Thanks again to Colonel Berkland, Major Peterson, Captain Doe, and Chief Lokken for being here, and of course, thank you to everyone for tuning in. We hope you got some good information from today's show. If you have more questions for us, please send them via the comments section. We'll continue to answer them even after this broadcast. You've been listening to the 354th Fighter Wing live virtual town hall. Take care and stay safe.